Hello everyone. Today we are going to discuss about existential therapy or existential model. What is the meaning of this life? For what purpose we are living in this world, or what is the meaning of existence? Sometimes this kind of questions will arise into your mind, right? We are going to discuss about that. Existentialism. First we will see what is existentialism. Existentialism is a philosophy that talks about existence of a person, freedom and choice of a person. Existential self include what the person does and what is his self. Existentialism concept make a person to ask some questions like what I have asked in the first. What is the meaning of this life, or what is the purpose of this life? The term existentialism was coined by Gabriel Marcel in 1940s. Danish philosopher Soren Kierkegaard is commonly referred to as the father of existentialism. Kierkegaard stated an important and interesting statement, that is, I exist, therefore I think. The main ideas of existentialism are importance of person and his choice, anxiety regarding death-like extreme situations, meaning of personal relation, authenticity of this life, religious concept or what is the meaning of religion, social criticism and what we can learn from criticism, etc. So, we can say existentialism focus on individual human life. Kierkegaard says that human discontent could only be overcome through internal wisdom. That means if you have internal conflict or intrapsychic conflict, through internal wisdom, you can sort it out. Later, another psychologist named Natchez developed the theory of existentialism. Otto Rank was considered as one of the first existential therapists. Through the writings and teachings, psychologists Paul Tillich and Rollo May brought existential therapy into the mainstream of therapy. Later, British philosophers expanded the concept of existentialism therapy. From some researchers' point of view, existentialists divided into two groups. They are philosophers and writers. Again, this philosophical group are divided into two. They are aesthetic and another religious. Existentialism is making an important question, or it is asking an important questions to individual, that is, what does it mean to be existing as a human being? The answer of this question cannot stop in one or two sentences. It may take us to different direction. If you ask these questions to yourself, you will not get a simple answer or single answer. It will take you to different directions. Existential therapy will talk about all these things, all these answers, and the therapy will help the patient to understand the meaning and purpose of this life instead of thinking about negatives and criticism. What is existential therapy, or what is the meaning of existential therapy? That we will discuss now. Existential therapy is a philosophical approach that helps to explore and understand life and difficulties of life from a philosophical point of view. It focuses on whole human being and encourage the human to live the life and take responsibilities of life, including success as well as failure. Existential therapy will help the client to recognize and decide what to do in life, and once the client recognize and decide the life pattern, they can go ahead with the clarity to future life. Existential therapy will help the client to live negative and how to run his life with positive thinking. So, it will help the client to recognize and decide the life pattern. The fundamental approach of existential therapy is intellectual. So, we can provide existential therapy to the people who have intellectual capacity and not to who have chronic mental health and behavioral problem. This therapy can give to the people those who can able to think. It cannot give to the people who have chronic mental health problem and behavioral problem, because these kind of people or this group of people cannot able to think properly. Existential therapy can give to young adults and youth who all are suffering to make a decision and choice in life. It can give to the people who are suffering with anxiety, tension, addiction, mild depression, only mild depression, and acute behavioral and emotional problems. Existential psychotherapy is based on the idea that all people experience intrapsychic conflict, or otherwise we can say inner conflicts, due to their interaction with certain conditions such as death, freedom, isolation, and meaning of life. A clash with any of the situation will produce an anxiety in person called existential anxiety. This anxiety will affect the physical, psychological, social and spiritual awareness of the person, which may lead to long-term consequences or long-term complications in life. Death of loved one in unexpected time may develop severe anxiety. This is an example for existential therapy and existentialism. Sometimes we cannot accept the reality. If the death of loved one in an unexpected time may develop severe anxiety and we cannot accept the reality. Reality means necessity of death in human existence. It leads to failure to make proper decision at that moment. Sometimes we will go to a level of psychosis. Psychosis means disconnected from the reality. In this situation, existential therapists can help us to create a balance between being aware of death and necessity of death in human existence. Once we get the balance, we can go ahead with proper decisions. Existential therapy process. Existential therapists do not focus on the person's past. Instead of that, they work along with the person in the present life and will they try to explore the person's choices and plans. Simply we can say both the therapist and person work together to understand the things happened in his life. This process will help to develop an insight into the self of person. Existential therapists will use the past as a tool to promote freedom and assertiveness in person and will make the person to realize that they are neither unique or not changing for a particular purpose. Therapy will help the person to remove the obstacles or we can say obligatory chains which preventing them from existing in this life in a completed way or perfect satisfactory way. It will be useful in many health conditions like depression, substance abuse, anxiety, terminal illness, suicidal ideation, and PTSD. PTSD means post traumatic stress disorder, and childhood abuse, violence, rape, etc. In this kind of condition, this therapy will be useful. Existential therapy will improve the self-awareness, self-understanding, self-respect and self-motivation. Through the therapy, the person get a realization that he or she is responsible for their life and choice and recovery of their life. Existential therapy will help to fight with inner or internal conflicts of the individual. Existential therapy mainly focus on four areas of person's life, such as physical, personal, social, and making area of life. Physical area is focused on physical or body and body needs. Social area focus on relationship in the society. Personal area is concerned with self and self-understanding, and making area is about values, culture, and religious belief, etc. Existential therapy can perform along with other treatment modalities because an existential therapy process may not directly talk about the primary issue of the person. So, it is an adaptable theory. That's the deepest observation of person we can see in existential therapy. So we can conclude that existential therapy is a unique therapy which helps to explore and reveal the difficulties and inner conflicts of the person based on a philosophical perspective. The therapy helps to see the world in normal way how the patient is seeing and help them to make choices in their life based on their insight.